What's going on, everybody? Welcome to the Alex Cuesta Show. Sorry about that. I had a slight malfunction with our video there, but it is what it is. How's everybody doing out there on this Wednesday, April 10th of 2024 for episode 119? If anybody notices, it's just me solo right now. David is off on another escapade. He is going to do another part of his sex change operation. He's doing the Mulvaney. He is trying to get as little as he can done to his face to make him look feminine, but not super feminine, so he can go back if he wants to. No, just kidding. David's feeling under the weather, so he'll be back with us next week. All things goes well. If you like what you hear today, give us a like, share, follow, subscribe, rate 5 stars. If you're watching on X, please repost this and share it. If you're watching on YouTube, definitely go and smash the like button and subscribe. And anywhere else you want to look for us on the socials, just go search at the Alex Cuesta Show. Real quick before we jump into this week's show. Last week, we had Rob Noor on. He is a streamer and a populist conservative. He goes and he debates, anyone and everyone on the left over on TikTok and places like that. He's debated Destiny and other people. So it was a fun show. We went a little while with him, and it was a great time. And one thing I also want to do real quick before we jump into this guest, one of our past guests, Billy Prempa, he is running for office over in New Jersey. He's having a fundraiser on the 28th. I told him I'd give him this little quick shout out. Over on the 28th at Annabelle's House of Mozzarella. If you are in Jersey, over in East Rutherford area, go over there, support him. You could do, regular tickets, $75. You could just donate to Billy. Go help him out because he is a good conservative, populist conservative that we need to get in office. So definitely go there and give him a help out. So that's my recommendation there for you, Billy. We support you and we want you to do well and we want you to win. But this week, we have an absolutely important show, one that I think everyone's going to want to tune into, to listen to, because it's super interesting and I'm pumped. So right now I am going to bring him in. He is Dr. Peter McCullough. He is an epidemiologist, an author, an internalist, and also a cardiologist, if I'm not mistaken. Dr. McCullough, how are you?
Thanks for having me. I can't believe I finally made the Alex Cuesta Show. My gosh, after all these years. How did I make it on?
How did you make it on? Jesus, Dr. McCullough, how did you make it on? Because you are one of the most important people right now when it comes to understanding what the medical, I guess we want to call the medical cabal, is trying to do to the population. And you're one of the people that spoke a lot of truth during COVID-19 and the pandemic. And because of that, with the powers that be, you were effectively silenced and taken off of many major places. Now, before people sit there and start taking my word for it, I want you to talk a little bit about who you are, what you do, your experience as a doctor, accomplishments, accolades, things like that, so people can get an understanding exactly for your expertise.
Well, again, thanks for having me on the show, and thanks to each and every one of you for attending. I'm Dr. Peter McCullough. I'm a practicing internist and cardiologist. I'm trained in epidemiology. I'm located in Dallas, Texas. I see patients every day like I did today. I'm very involved in research. I am one of the most cited physicians in the United States in clinical research. I have focused considerably on the interface between heart and kidney disease. And worked extensively in high blood pressure, diabetes, high cholesterol. Over the last 4, now going on 5 years, I've shifted my focus to pandemic response. That is responding to the SARS-CoV-2 outbreak, COVID-19 illness, evaluating the risks and theoretical benefits of COVID-19 vaccination. I have, as a general point of reference, a typical professor of medicine would have about 25 listings in the National Library of Medicine. I'm coming up on 700 right now. And within the COVID-19 field, it's over 70 now. And despite really tremendous bias against publishing anything that disagrees with the government narrative. Now, I hold degrees from Baylor University, University of Texas Southwestern, where I finished top of my class, the University of Michigan in epidemiology, and now the Oakland University William Beaumont School of Medicine for cardiology fellowship, and Southern Methodist University for later on for graduate studies. I did my residency at University of Washington in Seattle. So I've trained in the best institutions in the United States. I've been gone all the way through the ranks to professor of medicine. I've been a program director in cardiology for trainees. The highest rank I held was the chief academic and scientific officer for a very large health system, actually at the time, the second largest health system in the United States. So I've done it all. I've lectured all over the United States. I was the endowed lecturer named visiting professor at Harvard in 2019 in 2 departments. I've lectured at the European Medicine Agency, the FDA. I've chaired data safety and monitoring boards for dozens of clinical trials. Everyone in academic medicine knows me. And let me tell you what, when I came out with the approach to treat COVID-19 early to prevent hospitalization and death, and when I've come out with my analyses on the COVID-19 vaccines, not a single person in academic medicine challenged my viewpoint or my analysis.
No, it was all the media. It was all the media that wanted to poo-poo you and other people like Dr. Malone and, other personalities like Joe Rogan, who came out for treatments that, if I'm not mistaken, found to be effective around the world in terms of early treatment. Now, I don't think you guys were necessarily saying like when it is full blown and it's upon you, this is going to really work great. But I thought a lot of it initially, what you guys were preaching for was, hey, if you can be in the early stages and you can find this is super effective in the early stages. Am I correct with that?
Yeah, it's true. It was early treatment was the key. Now I treated now thousands of patients. I've lost a few, so it can be a fatal illness. I don't want to minimize SARS-CoV-2 infection. Fortunately, there was a learning curve. 2 major developments reduced hospitalization and death. One was actually just getting early treatment, but we're talking in the first day of, in multiple drugs. No single drug is necessary nor sufficient. We need to use drugs in combination. And then the second is developing immunity. Once people have had it once, the second, third infections are milder. But this wasn't about any single drug. It was about a protocol. So it was published as the McCullough protocol in the American Journal of Medicine, became the Association of American Physicians and Surgeons Bedrock Treatment Guide. It was 2 highly cited peer-reviewed papers, American Journal of Medicine, then Reviews in Cardiovascular Medicine. And we adapted, McCullough protocol broadly used virucidal nasal sprays and washes that were supported by trials. We used monoclonal antibodies when they were available. In the first 2 years of the pandemic, remember, we had no oral emergency use authorized drugs, none. So we used hydroxychloroquine, ivermectin, later on, Paxlovid.
How dare you use horse medicine? How dare you?
Well, the point is we didn't have anything else. When Paxlovid came, molnupiravir, those could be used, azithromycin, doxycycline, aspirin, prednisone, colchicine. And so how this happened is we needed products that had a signal of benefit, acceptable safety, and to be available. And then we are adaptable over time. That's how the McCullough protocol worked. And, I didn't get on TV saying, oh, this drug is a miracle drug or that drug's. And I wasn't pushing any drugs because we knew that in the original version of the McCullough protocol, we knew that only high-risk cases needed to be treated. The vast majority of people needed no treatment. So I wasn't pushing anything, but yet the press cast me as pushing one drug or another. The press casted me in one political party or another. They were never right about that. I mean, it was really astounding what was going on.
And, when you love that when the press does that, they hook on to their narrative and things like that. And, and I want to explain to people, because I don't know if many people know what an internist does or, an epidemiologist does. Those names are thrown around. An internist, you specialize on the internal organs, the system of the body, the function of the internal organs. And an epidemiologist is someone that is studying the way the drugs also affect these things. And so you're specializing in something that we really should have been using, right? Your expertise more and more, because this is kind of what you train for, these types of pandemics. And, you working in tandem with other infectious disease doctors and things like that. Like, this should have been a more hands-on team approach than I think that it was, where all of a sudden we're looking at, Dr. Fauci on TV and we're following everything Dr. Fauci says and Dr. Birx and everything and all the things that she said. And it's like, and then any doctor outside of those two that weren't towing the line all of a sudden they were quacks. All of a sudden they were, you became a huge right-wing celebrity. And I don't think it doesn't seem like that was your intention, that your intention was to provide the best care. And, something about medical care, it's a science, right? Not every doctor is going to agree on the exact treatment, but there usually becomes a consensus of, like you said, these are the accepted drugs that we know to show some effect in some patients, not all, right? So when you're looking at what's going on to you, and now all of a sudden you're being asked to come on, big time shows on the right. You're being asked to come on things on like The Blaze, right? Timcast, Hannity, like Fox News. And are you sitting there looking around going, I've avoided this my whole life. I became a doctor to help people, not to be a politician. Like, what the hell's going on here?
Well, and I've told actually all the news outlets that I'm a political independent. I voted on both sides of the ticket. I have no problem doing that. I've been very hard on Trump and Biden. Now, this is very important. I've been hard on both Trump and Biden. And so, as we should, there are employees. They shouldn't be treated as kings because they're not. And, I've been on ABC News. I've been on, and I'm happy to go on any channel. But you're right. People want to try to label us. And, they always say, what happens when you mix medicine and politics? You get politics. And I did grow to become a public figure. I have more followers on Twitter than most political candidates do.
I know you have 1 million followers. That's fantastic.
And they run unfollow programs and all these censorship programs against me. So I've had some consultants say that in terms of the real number of people who actually are seeing my thoughts every day, it's probably in the tens of millions. I've been on, I think I've been on 5 times. It's on Twitter right now, but I've been on 5 times on Daystar. And Daystar, the most recent indication was the reach was 2.7
No, I lost you for a second.
billion.
2.7
billion with the B. So the bottom line is, I'm not worried about about being censored, what have you, but I am worried about people being harmed. And I've watched people being harmed by 2 mechanisms. The first is being denied early treatment or having early treatment suppressed. And I've watched them be harmed by COVID-19 vaccination.
Now, is this nefarious on a lot of the doctors' parts right now? Or is it something where, unlike yourself, there are some doctors who are scared, right? Because I feel like you're somebody who's not scared. You're going to try and do the right thing. And, maybe it comes with the fact that you have your tenure, you have your position in the medical world, and you're not as worried about things because people know who you are. But I feel like, are some doctors doing this for nefarious reasons to collect from the pharmaceuticals? Or are there more doctors that are just kind of like, hey, I don't want to lose my position in a practice. I don't want to lose my practice. I got to feed my family. I want to continue to be a doctor. What do you feel is more to blame in terms of the way doctors treated this?
Well, let's talk about doctors as a big group getting on the wrong side of issues. So around 1850 or so, Ignaz Semmelweis in Vienna, Austria, noticed that doctors were spreading infections doing pelvic exams in women, actually from cadavers into women.
Oh.
And in 1850, he said, no, he did the research, said, no, we need to wash our hands. And you know what? Doctors did not follow him. They disrespected him. They censored him. They slammed him for 15 years. And those doctors were on the wrong side of the issue. Sir Austin Bradford Hill in around 1949 said smoking causes lung cancer. Do you know that doctors smoke? They advertise cigarettes. Nurses smoke. They advertise cigarettes. This went all the way to the tobacco settlement, 1999. So let me tell you what, doctors have been on the wrong side of the issue a lot. And they're on the wrong side of COVID-19, failing to treat patients and now pushing the vaccines. And I think I told Tucker Carlson early on, I said, listen, I think it initially started in fear. I think doctors themselves were fearful of getting the virus, so they retracted. They didn't want to face patients. They didn't have courage to face COVID. That's the title of my book. They didn't have courage to face it. And then later on, as things got deeper and deeper, once they got into the vaccines, the doctors took the vaccines. It's physically in their bodies. Now they've been indoctrinated, and doctors are having the hardest time realizing that what they're seeing, blood clots, heart damage, stroke, all these things that are happening. A prominent cardiologist who was in my circles for years just had a sudden cardiac arrest and died. It was announced today by the American College of Cardiology. Doctors are absolutely terrified of what's in their bodies.
Now, if you're a doctor and a practicing, and as a doctor, you got to constantly be a student, right? You got to constantly stay up and know what's going on, especially within your specialty. This isn't the first time we've dealt with coronavirus. This isn't the first time that we dealt with coronavirus that has also gained a strong strength, right? We've had MERS, we've had other versions of very strong, very deadly, very contagious coronaviruses. So why did this get so much different treatment than what would have been? Because, early on, I listened to a lot of conservative networking, and one of the ones I listened to is Glenn Beck. And I'll tell you right now, Glenn and Stu were on top of this months before this even got here, saying, hey, you're going to hear social distancing. You're going to hear masking up. N95s don't work. P100s are the better ones. Particles here. And they were giving all this rundown, and they were talking early about, hydroxychloroquine. This is, shown to be effective, blah, 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 in certain things. And they were known to, be early treatments and maybe not actually fix the problem, but mitigate it so that you're not on your deathbed. You get sick, you recover, you move on. What made this so different in the medical world that you saw, that why they were treating this so different?
Well, in many respects, you're right. So there's 4 human beta coronaviruses, SARS-1, MERS, and they largely, were self-limited. Now, people did die with the SARS-1, but it was a limited outbreak, and in a sense died off on itself before there was a vaccine. Same thing with MERS. Here, within 3 days of President Trump announcing the crisis, Moderna said we have a vaccine. 3 days.
Yeah, crazy.
And now it's coming out in Brad Wenstrup in the House of Representatives is chairing the COVID select subcommittee. Mm-hmm. It's all coming out. The vaccine was planned years in advance. And, recently in January, Anthony Fauci was on Capitol Hill testifying. So was I. I testified the same group just a couple of days later. Yeah. And what came out of this so far is Fauci did concede the creation of SARS-CoV-2 was for the purposes of making a vaccine. So the reason what made this different was the vaccine. The plan to have COVID-19 was to have mass vaccination of the world.
So my question to you is now, if anyone that doesn't listen, I forget what the name of it was, but the Bill and Melinda Gates sponsored basically a war games type of scenario where they talked about a coronavirus going around the world. Is that kind of what triggered this whole entire response to get a vaccine and to start the gain of function research, which we know, and Rand Paul has been fantastic on unraveling and unpeeling back more and more. I think today they had a huge revelation about the gain of function research and Dr. Fauci's involvement with the lab in Montana that were doing those types of things. Is it something where they were planning this out? And were you someone that was privy to knowing when that war game type of scenario was going on? Have you ever been invited to anything like that where they want to have your expertise there? Because I know they have different experts from different areas to participate in those types of things. It's not the first time the Bill and Melinda Gates Foundation has done a war game type of scenario like this.
Well, you're right. To tell you the truth, I was caught totally surprised by this, flat-footed. I wasn't part of any of the planning. Yeah. But if we were to go back originally, I think probably 2005, the CARES Act, mm-hmm. which was written by Congress and HHS, said there will be pandemics. And there will be and they named them all. And they said there will be countermeasures, predominantly vaccines and therapeutics, masks and things like this. And everything's going to be immune from liability. That was 2005. That's crazy. I think the next big inflection point was 2012. DARPA, the research unit of the military, announced the ADEPT P3 program. It's still on their website. You bring it up. ADEPT P3 said we will end pandemics in 60 days with messenger RNA vaccines in 2012. You'd think somebody in the Trump administration would have briefed Trump on that so he wouldn't come out and say that, Operation Warp Speed invented these. No, this was 2012 that this was the military's aspiration. Now we learn that that Dr. Ralph Baric, Anthony Fauci, Peter Daszak at EcoHealth Alliance, Dr. Xingling Ling in China, they were working together for years to create SARS-CoV-2. They published their work in Nature Medicine. There you go.
This is what you're
I'm not
talking about,
making this up.
Dr. Shannon Green, Pandemic Prevention Platform P3. And
Right.
yeah, it's still up there, and I'll put a link
click
there.
on the graphic. Click on the graphic to show the life cycle of this. Is there a link you can click? No, go back.
The autonomous diagnostic, the adept, that one.
Yeah, maybe click on that. You'll see. I want to show. Okay, let's see if they'll show the life cycle. Yeah, I have to put on my glasses to help you. There's a link here. Click on. Click on that autonomous diagnostics. That link there. Yeah, and scroll.
I see tags, similar tag content.
Okay, just go back. Let's see. Let's go back up, and there's a life cycle.
I think I'm in the wrong spot here.
Yeah, but anyhow, you're close. But
I'm close. But people can go and mess around with this themselves, and
right. But the point is, this is 2012. They had put this out here, and what we learned is that there was gain of function research being done. Yep. It was a U.S.-Chinese collaboration. It was to make a SARS, a COVID virus that could invade a human respiratory epithelial tract. And in the paper, Vineet Menachery is first author. Ralph Baric is the senior author. The title of the paper is "A SARS-like Wuhan Institute of Virology 1 virus is poised for human emergence." This is in 2015, 2016. They thank the National Allergy Immunology Branch, Fauci. They thank personally Peter Daszak. They say it's gain of function research, but it started before the federal moratorium. It's all laid out there. And they say, listen, we did it.
What was he part? EcoHealth Alliance, I think, was the name of Peter Daszak.
Right.
And that's a huge
he's the guy
money funneling group that basically Anthony Fauci was wiping his hands clean of the money because they were putting it in the NIH through EcoHealth Alliance, and then EcoHealth was putting it over to Wuhan.
That's it. And not only the money, though, but actually the plans. So the letter that Daszak got recently from the committee, he's going to be May 1st. So listen, we want to know everybody from EcoHealth who was in that Wuhan lab. I'd want to know for Daszak, how many times did he go over there? There's a report that he spent like $250,000 of federal funding just flying back and forth. Did Daszak put on a hazmat suit himself? And was he working with Xingling Li as they created COVID? I think all of this is going to come out, but the virus was created for the vaccine. And the vaccine was honestly a big test of, could you mass vaccinate the world? And let me tell you, we should never vaccinate into pandemics, never, because the virus is too prevalent, and the vaccine are always sufficiently weak that what we're going to do is we're just going to promote resistant strains, and that's exactly what happened. So this pandemic would have been over with like the Spanish flu. It would have been done in 2 years. Instead, now we're in our 5th year.
And, and I feel like with the vaccines, like you're saying, they can always only be 1 or 2 steps behind, right? Because you're taking that strain at the time, and by that time, they're onto another strain. And typically those strains get weaker the more people get it. And that's just, common knowledge. I don't have to be a doctor to understand that about, viral diseases that come on strong. And that's a typical thing. So, the one thing I want to talk to you about is gain of function research. I feel like it is one of the biggest tragedies that nefarious people are the ones that are doing it, because in theory, gain of function could be fantastic, right? If it is done in the proper way, where we're sitting there and tackling these tough issues and in a very close way, trying to find things out in a good way, right? Like but it's being used for nefarious purposes, like we're talking about here, where, you can look at certain, like any sort of viral things. And I understand kind of the excuse of we want to be prepared, right? But being prepared is different than being, I guess, aggressive and trying to create new things just for the sake of creating them. And, and Rand Paul's pulled up many things about Dr. Fauci having, monetary gain involved in a lot of the vaccinations. So it is completely sad. So you have been kind of in the media, at least, brought through the ringer in terms of, you're a vaccine denier and you're just all these things, and you're promoting misinformation and disinformation. And it's a fun fact, as this was going up on YouTube, and I created the event right underneath right away, find COVID-19 misinformation and how to spot it right here. And it's just funny that, whenever you're brought up, someone who, like you said, cited 700 times, 70 times just on SARS-CoV-2 alone, to have that there, it's like the peer review process is still the peer review process, even though it can be flawed. In order for you to get those publishings, there has to be enough people saying, no, what he's saying is sound enough to be put out to his peers, to be researched and to be challenged, right? So it's bizarre that they would do that. So you talked about we're in the 5th year of the pandemic. I feel like most people are looking around going, COVID's over. What do you mean by we're still in the 5th year of the pandemic?
Well, we're still seeing a push for worldwide mass vaccination. There still are reports of death. Recently, I had a patient report that their elderly relative is death. I still have some patients getting sick right now. Remember, it started in early 2019. We had all of 2020, all of 2021. 2022 was Omicron. We've been in 2023 was Omicron. So we're now actually, 5 going into the 6th year. This is starting to be a long time. But let me tell you what, the most important, I guess, claim I could make is that I haven't been wrong on anything through the pandemic. I've been very evidence-based. People can't say, well, you were wrong on this. No, it's not the case. What YouTube is doing is they're actually they're performing propaganda. Absolutely. So you mentioned one of 6 important propaganda tools or terms. People should recognize this. These terms are not scientific terms. They're not medical terms. They're propaganda terms, and they are misinformation, disinformation, malinformation, anti-science, anti-vaxxer, and conspiracy theorist. Mm-hmm. And I can tell you the reason why is they were used extensively in Nazi Germany as propaganda tools. Listen, so anybody using these tools ought to go right back to World War II and see what side they want to be on. These were extensively used here, and they're used by people who are trying to gain a power dynamic. So you can imagine if YouTube casts me as misinformation, then what? YouTube has the power, right? They have a power dynamic over me. If Peter Hotez in Houston, who's a vaccine promoter, if he calls you the anti-science, what he's saying is he holds science and you don't. And science is a process. You're not for or against it. It's a process. Mm-hmm. If you use the term conspiracy theorist, which is actually an official intelligence community term, somehow that's casted as a tinfoil hat. So, a great video out there. Why don't you bring it up? www.rationaltheorist.com, because I'm in it. And let's play that, Alex. Let's play rationaltheorist.com. Sure. So everyone can learn what we're talking about. While you're doing that, I'll give credit to Monica Schmidt in Australia who came up with this, www.rationaltheorist.com. So we don't have conspiracy theories.
Let me pull that up real
I'm putting a challenge on the Cuesta power, the power
slower than I'd like
here. Yeah, well, I tell you what, they're probably running all kinds of attack programs now that I called out that URL. But but let me tell you that we don't have conspiracy theories. Here we go.
You want me to play it now?
Yeah, see if you can crank up the volume.
Yep.
The central bankers can dictate the rules of when and how you can use your money.
What are you watching?
Oh, I didn't know it's some conspiracy theorist spreading the usual rubbish.
Yeah, but isn't she some kind of investment banker? What if she's right?
Right? Come off the grass, she's a conspiracy theorist.
With COVID-19 vaccines, there isn't a single paper
in the New England Journal of Medicine, JAMA, Lancet, where the conclusion is the risks of the vaccines outweigh the benefits.
Do you think that it could be true?
He's a conspiracy theorist.
But isn't he a pretty famous doctor? Like, why would he tarnish his career just to make those things up?
The sharing of biased and
false news has become all too common on social media. Exactly what people think, and this is extremely dangerous to our democracy.
Along with millions of others, I have recently been called a conspiracy theorist for the first time in my life, and it just does not sit right with me. We've been forced to embrace this term, but what if it's being intentionally used to discredit people? And then it dawned on me, we've never been conspiracy theorists because our theories are logical, evidence-based, and even debatable if people would debate us. We are not conspiracy theorists at all. We're actually rational theorists. Until now, maybe you've been afraid to ask questions because you've seen people publicly vilified and bullied for doing so. But things have changed. Now is the perfect time to ask questions because you are a rational theorist and your theories are exactly that. Rational.
So, Alex, there you go.
Awesome. I've never seen that before. That's
yes,
great.
Your theories are exactly that. Listen, we all have theories.
Yes.
Like I have a theory that somehow you must like, Manchester United or.
Well, that's my high school, Manchester, New Jersey, and
Manchester, New Jersey. I have a theory. I have a theory that maybe you're Italian or Hispanic. You have a theory that maybe I'm Irish. We all have rational theories. And what Monica is saying is, don't let anybody try to put us down by saying that you're a conspiracy theorist. And I don't use those words. Mm-hmm. I will not use a propaganda word. People say, well, when Marty McCary was testifying at the House, he's at Johns Hopkins, he was saying the biggest spreader of misinformation is the government. I wouldn't use that word. I would say, listen, there's simply clinical data, scientific observations, and there's multiple points of view, and we need to discuss. One of the things propaganda has done is shut down discussion. Yes, do you know? When I testified in the U.S. Senate 3 times, by big advance warning, advance notice, Fauci was invited, Deborah Birx, our Surgeon General, Murthy, and then before him, we've had Robert Califf, head of the FDA, and Stephen Hahn before him. Do you know none of them have showed up?
Of course not. Why would they?
To even have a discussion. So and I've gone to Penn State University and no one would show up. My former employer, University of Missouri, I showed up and gave a lecture. None of the faculty would show up. University of Kansas, I showed up, and again they submitted a video. They said, well, you don't do this. And so when Peter Hotez, who's a vaccine promoter, and it turns out Peter Hotez had biodefense grants for COVID vaccines back in 2017.
Wow.
Okay, with the Chinese, with Fudong University. So he was going on CNN pretending that he was surprised about COVID. That was a charade. He knew that he was working on this for years. When he went on Joe Rogan, and then Bobby Kennedy went on, I had gone on, and there was a suggestion that Peter Hotez should get in a debate. I messaged Rogan. I said, listen, I said, yeah, I'd be happy to come down to Austin. Hotez lives in Houston. Hotez is a little junior to me academically, but he's got a few less publications, but he's in my ballpark. I said, let's have a discussion on vaccine safety. And Rogan said, no, he's afraid. And sure enough, Peter Hotez went on Johns Hopkins TV, and what they concluded is that's not the way we do science. We don't go on and debate things.
Which is insane, right? Because the whole entire purpose of the scientific method itself is putting your hypothesis up and seeing if it stands under rigorous testing and rigorous debate. There's supposed to be debate in the scientific world. That's the whole reason why, and in all the world, in academia, right? That's why we write papers, and the papers have to be peer reviewed. And then they go into journals to be read by other peers who can then write peer reviewed responses. And that's where the debate takes place. And all you'd be doing is taking those peer reviewed responses and bringing them to a form of conversational. And the thing is, someone like Peter Hotez, who, got pretty destroyed on Twitter when he went on Rogan because he was just saying like ridiculous things. He's somebody that he knows. And if you're a full-on leftist and you are kind of towing the line, because right now it is less of, someone like yourself who's concerned with people's health. The whole thing is to toe the line, to spread the message, to continue to stay on message. And they don't have much more outside of that, because Peter Hotez, when he debates you, would probably agree with you with 95% of things you say, but he can't. He's not allowed to, because he is in their cabal. He's not allowed to. He knows what you're saying about most vaccination things are true. He knows what you're saying, that you're following good science, the same papers he's probably read, the same doctors he's probably studied, but he can't. He's not allowed to, because then Dr. Fauci will come down on him. Then other people, he won't get that NIH grant that he's been trying to get for whatever research he's doing. So you have these people that, for lack of better terms, they're pretty evil, because they know this is knowingly saying and doing the wrong thing from a position of authority. And, some people may say that about yourself, right? From the other side, and you can name, call, and finger point. But like you said, things that you have said, statements you have made, go check them. They're true. None of them have come out to be patently false. So, and you could look at the other side, and there's been plenty of things that have been false, and they're trying to backtrack now, right? When they're coming out and saying, we never said the vaccine will stop the spread. It's like nonsense. Nonsense. I remember watching Governor Cuomo do it. I remember watching, everyone sitting there on the left going, go get the vaccine, because that's how we stop the spread. You social distance, and this is stopping the spread. And it was explicit. And it's what they do, though, right? And it's funny that you mentioned the words of propaganda, because the bottom line is all those words mean nothing, because misinformation, disinformation, malinformation, it's called lying. You're accusing people of lying. You're accusing people of knowingly trying to cause harm by lying about things. And there's already laws on the book for those things. We don't have to create new words. You're not allowed to openly lie about somebody's character, about, there's slander, there's liable. So the things that they're accusing people of are cute ways of saying people are lying and they're not being truthful. But they can't say those things because they know that they're the ones that are lying. So they have to make up these fancy words so that people can kind of, take this new vernacular, and it doesn't really mean it's a ridiculous thing. So I want to find out, in the medical world, do you have doctors coming to you saying, hey, you're right. I can't go out and openly say you're right, but I've been using your stuff and it's been one thing works for my patients, but I can't come out publicly say it. Have you found that a lot?
Oh, sure. Doctors contact me privately all the time and, lament taking the vaccine, regret what's happening, say they can't say anything because the institutions have very severe restrictions. Remember in California, AB 2098, it was actually, they're going to lose their medical license if they said anything against the vaccines. In France, they passed a law where if they say anything against the vaccines, they're criminalized. You can put in jail. Brazil is coming down very hard now. In both France and Brazil, you can't even get on Rumble. So you couldn't even do your show. Right? No, this is happening. Yeah. This is very severe. If we can't scientifically vet new products, especially new genetic products where nothing's known about them, the FDA tells us for messenger RNA that we have 5 to 15 years of potential worry after injection. It could cause side effects that long. So you take a Pfizer or Moderna shot from the last shot, and I testified on Capitol Hill. That's what I told them. I said, listen, this isn't over with in 30 days. This is not like a drug that gets out of your body. The genetic code is long lasting in the human body. Nobody knows really how long it's going to last, but you take a Pfizer, Moderna Janssen shot, as far as we can tell, I'm examining patients years later. I do blood tests. I find evidence of the vaccine in their system 3 years later.
Well, we learned, DNA is the major, like you have your genetics in your DNA, but the RNA is a carrier of information to your DNA, right? So it's not like we're putting normal vaccines where it's a more dormant version of the virus going in to create antibodies. We are actually trying to change the messaging component to our DNA to adjust our body, right? That's kind of I guess the theory behind the mRNA technologies. And you'll have people say like, well, they've been working on this mRNA technology for 20 years. And that sounds fancy, right? But you and I both know 20 years is not a long time for researchers to be working on things. Like that is a blip because you can't even get a proper, test on animals in 20 years in order to figure out things. And, one of the things that, you'll be critical of Trump for, I know I'm certainly critical of Trump for, is the way he sped up the whole entire process of testing the vaccination, right? And I think that this is something that, Donald Trump will say is a success. He was able to get this vaccine out there quick, get it effective, and that's something that the business side wise he'll say is a success. But to me, it's something that's one of the things we want to be rigorous, that we want to sit there and we want them to take the full 2 to 5 years, right? Because I think that's typically when you're doing these types of things, it's like 2 to 5 years at a minimum. And then you kind of start doing the human rollouts and things like that. We got this, what was it, 9 months? It was incredibly fast. And the experiment, the 2 to 5 year experiment, you're looking at them. They were meant to be us. We are the 2 to 5 year experiment of the RNA vaccine. And, there's talk about the potential of what the mRNA vaccine could do. And that's great. I love great medical potential, but I'd rather not have it find out if it's me, my kids, my wife, my family. So it's correct me if I'm wrong on anything that I said about all that stuff.
Well, you're certainly right. Now, in a paper by Lalani, they indicate that, there's been a love affair with messenger RNA technology since 1985. Goes back that long. Wow. The U.S. government has invested billions and billions of dollars in this, in companies all over the world. There's over 9,000 patents on messenger RNA, 9,000. And it's the inventors are all these big guys who work in these big companies. So I think at the top, I believe, is Sanofi, CureVac, BioNTech, Moderna, and the U.S. government. Messenger RNA was not invented by some guy in his garage. Don't be fooled by that. It's big business. The guys who are the real inventors, they have dozens and dozens of patents, and they have many dozens of manuscripts. So Agar Sahin and his wife, who worked for BioNTech, they I think could be credited as inventors. Carrico and Weizmann, who won the Nobel Prize for pseudouridination. So it's been a big team effort on the invention here. But you're right, 20 years and there's not a single product. It makes you think, boy, this is kind of difficult technology. So messenger RNA, which is the code for a protein, if it could replace a deficient protein, let's say a deficient human protein, so let's say a fully humanized code for insulin in insulin deficient diabetes or for alpha galactosidase and Fabry disease, could make sense. In fact, it was tried and it didn't work. But now the genetic code for the lethal Wuhan spike protein, the spike protein came out of gain of function research in the Wuhan Chinese lab. And now you're telling me that 75% of Americans have the genetic code from a Chinese biosecurity lab in their body? I mean, this is like a Tom Cruise Mission Impossible movie. This is like something out of science fiction. People are walking around with foreign genetic code from a Chinese biosecurity lab. And in a paper, it's a paper by Brogna and colleagues showing that at least half of people who take the shot, the spike protein, which is injurious and damaging to all the organs in the body, is physically circulating in the blood. The Pfizer Moderna spike protein is physically in the blood, and Brogna can identify it, the vaccine spike protein, for 6 months. That's as long as he looked, maybe longer. The messenger RNA, we have no idea how long that lasts in the human body. Recently, Kevin McKernan showed that there are RNases that hopefully break it down. So we're hoping that the messenger RNA goes away and it's just a matter of getting rid of the spike protein. That's the reason why I've published the breakthrough McCullough protocol-based spike protein detoxification.
I love that. So this might be a little far and this might be too much, but could this, what they're doing with the mRNA technology, could this be kind of like a light eugenics a little bit? Because like eugenics is trying to kind of, work on humans to figure new things out to cure other humans, but in a very terrible way. The best way to put it, like awful. And is this kind of like a light way of doing that? Like we're actually trying to change the body chemistry through these vaccinations. It's not inserting something so your body can learn and adapt. This is trying to tell your body what to do and to add something that is now going to be permanently a part of you in order to fix you. Is that too far to call it like eugenics light? Because I don't think it's full bore on that sense, but I studied Nazism, World War II. That was my focus in college. So like to me, it just seems like the doctor that is participating in this gain of function research would be the same people that would be more likely to be like, hey, eugenics seems like a great idea if done correctly.
It made me reflect on this as you were pointing this out is the book Illusions Dissolved by Dr. Suzanne Humphries. And she does a deep dive on the smallpox vaccine campaign, which was a debacle, by the way. The smallpox vaccine never worked. It was a dirty vaccine. It was, back then they didn't have any ways of purifying. It came from horses and from cows and even from human to human, arm to arm. So people were getting infected with staph and tetanus and syphilis. People died with the smallpox vaccine.
Wow.
And it was forced into children. Mothers were put in jail. There were public protests. And Humphrey says that the smallpox campaign, which countries were relentless on smallpox vaccination, it led right into pre-World War II eugenics. This idea that the government can decide what's good for the population, and if there's casualties, there's casualties. That's that type of thinking. But what we know now is that the COVID-19 vaccine, certainly the genetic ones. And by the way, we only had one non-genetic one in the United States. That was Novavax. Nobody ever talks about it. Still on the market. It was a protein-based vaccine, no genetics. And I've always said, listen, if somebody had a gun to my head and I had to take a vaccine, it would be Novavax. It wouldn't be the genetic vaccines because at least it's the spike protein. Sooner or later, you got to get rid of that stuff. But there's no genetics involved. Under no circumstances would I take an injection of genetic code. There's no way. And so with Pfizer Moderna, the messenger RNA in a paper by Marcus Alden using Pfizer, the senior author is Yang D. Marinis, they did show part of the Pfizer code get incorporated into human DNA in a human hepatoma cell line. Now, they specifically picked the reporter region of 444 base pair region out of the 400 or so base pairs, but it reliably got into the human genome within about 6 hours. No one's ever refuted that paper. And I have to tell you, I'm concerned that people who took the shots, they may have a mosaic of cells now where some of their cells are normal human cells and some of the cells have been transformed. They contain the code of Pfizer Moderna, and they may be producing spike protein low level now permanently. If this gets into the gametocytes, which would be the sperm and the egg, they can pass it on to children. This is extremely worrisome because the Pfizer pregnancy trial has been finally reported, by the way. Pfizer had a post-marketing obligation to do a randomized trial on pregnant women. They did it and they cut the trial short, but it's several hundred pregnant women in each group, placebo versus Pfizer. And what we found, shockingly, is that there was a 4-fold increased risk of birth defects in women who took Pfizer compared to placebo.
I mean, that's incredible, and it's sad too. And the thing is too, like, I want to also push for us to stop calling whatever the hell that they created a vaccine, right? Because I think what we found is, if anything, it could be an effective pre-treatment to lessen the effects. I think that's the furthest that it does, is a potential pre-treatment to lessen effects, because it didn't cure anything. It didn't solve anything. And I think the mistake was when we were trying to solve something this viral, which again, we know with these big spike, big contagion, viral type things, they eventually half-life themselves out, right? They continue to go down and down, and and what was the death rate of this? It was under 1%. I think it ended effective under 1%. So yes, it was super contagious. It killed a ton of elderly. It killed a lot of people with comorbidities. But if you were generally healthy or young, it didn't really affect that population. And I always go back to a chart, which I don't even know if I have on here right now, but it is a chart that shows the number of deaths in each age group. And it is from the CDC. And it is something that I constantly, oh, there is a provisional COVID-19 death chart. And I always found this interesting that, did they change this? They take it away? They might have taken it away by now. Show up. Yeah, this chart is gone. I had it saved for the longest time. And what it would show, Dr. McCullough, is that it was by age group and who was affected and who was dead. And when you got down to the like under 50 and below, you were near maybe like 3,000 deaths, if that. And it's crazy to see just the disparity in how many deaths occurred and how the brunt of it was 50 plus. So it's they are hiding so much about the effects and the things like that. So now, what is going on now with the bird flu? That seems to be the new potential scare. We had a human get it in Texas, a cattle farmer. And I believe, like you said, it was conjunctivitis was the symptom, pink eye essentially. What should we expect coming forward with bird flu? Is it something that we should have to worry about? I've been seeing things potentially, and I think you're going to talk to the gain of function research that was going on about bird flu. So talk about bird flu and what we can expect going forward with it.
Good. Alex, we're going to have to finish on this topic. I realize that
sure.
Time's gotten away from us. We're at the top of the hour. But briefly, bird flu is been around for decades. It's H5N1. There's also H7 and H9N1. There are strains of it. Now, it's a more deadly form of influenza. There have been several hundred cases over the decades. And when it does go from an animal into humans, particularly in underdeveloped countries, there can be severe cases where there's no hospital support and people die. There's been deaths in 23 countries. Yeah. There was a paper in New England Journal of Medicine in 2005 that described 4 deaths. And it looked like, honestly, they didn't get hardly any care. I think they died of secondary staphylococcal pneumonia. But gotcha. The point is, it has been deadly. And it transmits from either a bird into a human or livestock into a human. But in 2021, Gavi, the Global Alliance of Vaccine Syndicate, they announced that bird flu will be the next pandemic. and CEPI, the Coalition for Epidemic Preparedness and Innovation, formed by Gates Foundation, World Economic Forum, they have a self-amplifying messenger RNA vaccine program with a Korean university. And now in the United States, a company called CSL has a bird flu vaccine fully FDA approved, and they were supported by BARDA, the research unit of the military. It's called Audens. It's a cell-based antigen vaccine. Now they have already has an agreement for our government to switch to self-amplifying messenger RNA vaccines. So this is basically like messenger RNA, but on steroids. This is uncontrollable production of this foreign genetic code in the human body. All of this is happening in the context of a worker outside of Amarillo who gets bird flu in the eye. So the first question I have is, well, who tested him for bird flu? That's a CDC PCR assay. That's not, I can't test for bird flu in my clinic. So who tested him? And it turns out that there's been an animal test that can be done. Thermo Fisher has it. So you can test for bird flu in animals. And there's been several thousand animal cases of bird flu over the years. I think the United States, we're between 3,000 and 4,000 cases.
And wouldn't that be something that an ID doctor would, an infectious disease doctor would recommend that test when they saw it? It wouldn't be your general doctor that sees him, and they would sit there and see it and maybe pass that on to their ID doctor, and then the ID doctor would kind
Well,
of
even
make
then,
that, right?
you'd contact no, Alex. You contact the health department. They'd have to get you the CDC assay. So the question I have is, why was this guy tested? He's not even sick. He has pink eye.
Yeah.
And then what's happened in the last few days has been nothing short of spectacular. We saw a series of events, and this is all on my Substack, a Courageous Discourse, if you really want to get in the know on this, where the CDC comes out with the announcement, what was it, 5 days ago, about this one guy getting bird flu. Then we have a notice that the Texas Agriculture Commissioner Sid Miller announced that Cal-Maine in Farewell, Texas, out in the Panhandle, the nation's largest egg producer, is going to kill 2 million chickens after a case of bird flu was detected in its facility. Now, listen, bird flu, again, there's been thousands of animal cases. In Dallas, they had actually a whole flock with bird flu. This is all on the website. And what happens is, this is the hot zone. John and I summarize this. If you go back one, I think you'll see it. Go back to another blow to Texas agriculture. You'll see it. He has it. This categorizes the response. Never have we seen slaughter of a couple million chickens because of bird flu. Now go back and look at the one I put out this morning. I indicate there it is. That one right there. That there's gain of function research going on here. Here's the CDC health advisory. Scroll down, and you'll see a manuscript comes out. Keep going down. Last fall, and this manuscript says, look at the title. Look at the title of the manuscript: a comprehensive review
of highly pathogenic avian influenza, an imminent threat at doorstep.
Okay, keep going down. I mean, so this is all telegraphing. Oh, now you have to.
I'm not
I
continuing.
thought I gave you a free
fully
subscription, Alex. I'll give you a free subscription.
But
I
think you. Let me see if I can go find that.
The bottom line is, now the next thing is CSL says that they have a vaccine, and now you see the news lighting up with fear-mongering stories. So what we know here is that, listen, we can treat this. It's a treatable illness.
Yep.
If there are cases, I don't believe the public is at risk at all. It's not transmitted by eating chicken or eating meat, so we don't need to kill chickens or kill eggs. And what's going to happen here is, I think we're going to see a giant push by the vaccine, what we call the biopharmaceutical complex, to push a narrative of fear and then vaccination. And I anticipate it'll first be in poultry and cattle farmers and workers, and then it's going to spread into the general population, where really all we need to do is be prudent. We know the virucidal nasal washes and sprays work, like povidone iodine would be great. There's good in vitro data for that. We know that we have 4 influenza drugs we can prescribe, Tamiflu being one, but there's many others. And of course, we have antibiotics in modern care. So for the seniors who get the bacterial superinfection, we can manage it. So at the wellness company, where I advise as a chief academic and scientific officer, as a nationwide health alternative, we're going to actually broaden our contagion kit, quickly, and we'll cover this possibility if it becomes a real threat. I don't anticipate that it will, but come on, we're looking about a massive investment in bird flu vaccines.
And and the thing is too, and I see this, and I'll let you go after this. Well, I appreciate you giving me this hour. I'd love to have you back on some point in the future as well. I feel like we could go more if we wanted to, but I feel like this is a combination of two things, because World Economic Forum has been talking about getting us to eat bugs now for years. And I feel like this is kind of the doorstep, right? Oh, avian flu's here. Oh, cow and chickens can both carry it. We're going to cull 2 million chickens. We're going to continue to cull cattle. And, so now do you want to pay $33 for that steak? No. Oh, here's the mealworm patty that tastes just like it, and it's only $15. Enjoy. And, and the thing is too, and I'm telling you right now, next thing coming at the doorstep is they're going to go, wait, you eat crab, you eat shrimp, you eat lobster. Those are essentially bugs of the sea. What's the difference? They have thoraxes, and you're going to get that type of messaging. And I feel like that is where we are, along with as yours. I feel like this is kind of a symbiotic relationship between and it's not even symbiotic. They're the same freaking people. Your central planners, they are the same exact people that are all working together. So I feel like that is the future that we're looking at. And I also feel like following people like you, going onto your Substack again, Courageous Discourses, going onto there, and I had the link right over there. Go onto your Substack, follow you on X, and people like you, because you guys are going to be the ones that are going to, you're going to at least be honest. You're going to be honest, and you're a doctor. So doctors aren't always 100% right, but you guys have very good educated guesses, and the honest ones are the ones we need to follow. The honest scientists who will admit that this is trial and error. This is a scientific method. None of this is perfect. What works on A is not going to work on B, but I'm damn sure going to try and get both of you healthy and fixed. And I think that's where we need to be. So Dr. McCullough, thank you so much for your time. I really appreciate it.
Well, thanks for having me. Great show.
Once again, he is Dr. Peter McCullough. He's an epidemiologist, an internist, a cardiologist, and an author. Honestly, fun fact, go to Scholar Google, go look at that, and just type in Peter McCullough. You will get a bevy of peer-reviewed papers to go and read about his work if you want to test out and see what he's done and how he's done. Go follow him on X at P_McCullough MD. And we appreciate everyone that watched the show on X, everyone that watched the show on YouTube. If you like what you heard today, go and like, share, follow, subscribe, rate us 5 stars on all the places, Spotify, all those things. If you're watching on X, repost this, go follow us there. If you're watching on YouTube, thank you. Smash that like button, subscribe, and spread the word to your friends. We appreciate everybody that watched. We appreciate everyone that is going to listen. And hopefully Dave is back healthy next week, and we'll be back at this. So long, everybody. Thank you so much for watching.